Hi, and welcome back to my channel, Respectfully Angie. It's been a while since I've been here, but I'm here to talk about Graves' disease, hyperthyroidism, which I was recently just diagnosed with less than a year ago. So I'm trying to learn about this myself as well as give some information to others that may have been going through this, may be going through it right now. So just let's just do this together. Again, this is regarding Graves' disease, hypertension. Hyperthyroidism. Okay, so what I'll be discussing is what is it, some symptoms and some causes. Graves' ophthalmopathy, and I probably didn't say that correctly, but basically it's thyroid eye disease. So I will be calling it that going forward. And some diagnoses and treatments. And of course, you want to consult your doctor before doing anything. What Graves' disease is, it is a autoimmune disorder that happens when your thyroid is getting out of control. Is getting completely out of control, and it causes your body to go into all types of other situations happening, symptoms, diagnosis. Each person is different. Each person will discover different things, as you may know, and we will get into some of that, what I've experienced myself, um, since being diagnosed with it, and we're just going to go from there. Symptoms and causes. Um, some of the symptoms is a rapid heartbeat, weight loss despite increased appetite, tremors, anxiety and irritability, fatigue, heat intolerance, increased sweating, muscle weakness, difficulty sleeping, changes in menstrual cycle, and that just to name a few. And I know what happened with me is my heartbeat was just extremely fast, beat extremely fast, like it's about to come out of my chest sometimes. And it get even worse at night when I'm trying to sleep, and it's like, oh my goodness, what is going on here? Now the weight loss, I was excited about the weight loss because I thought it was something that I was doing because I am on a weight loss journey. So I thought, and when the weight just was coming off so super fast, I'm like, wow, I must have really tapped into something. But come to find out, I have the hyperthyroidism, which takes your metabolism to an extreme, because of the increased thyroid hormones in your system. um, Tremors, kind of shaking of the hands. I never really paid that no attention, but when I went to my endocrinologist and they tested me, and she did say I did have a few little tremors, anxiety and irritability. Yes, at times it seemed like any little thing, it just irritate me, just so irritating. And I'm like, okay, that's some of the symptoms I had when I was having menstrual cycles. That type of feeling, that type of like just get away. I don't want to be bothered. Fatigue. Yes, I did feel fatigue. Again, I contribute most of that to me being overweight, but it's just magnified, I guess, even more when you have Graves' disease. So you feel tired. You don't want you want to do stuff, but you can't do it because you just feel so extremely tired and worn down. Another thing that I experienced is difficulty sleeping. Oh my goodness, I have the hardest time falling asleep at night. And it's like, so if I get about 4 hours of sleep a night, I'm doing good. And but most times, I'm just in the bed. I'm just twisting and turning. Just laying there. Can I fall asleep? Even though I'm tired, I know I'm tired. My body is tired. I need to sleep. I just can't sleep. Difficulty falling asleep. So that's definitely one that has affected me on this. So I'm trying to work on that. Um, Normally, when I do feel like I'm getting ready to go into a good sleep, of course, that's when the alarm is going off and it's time to jump up and get ready to go to work. So that's not good. So I'm driving to work tired. I'm at work, I'm tired. I'm coming back home, I'm tired. But when it's time to go to bed, that's the weirdest thing. Still can't go to sleep. So that's one of the biggest things there. Some of the causes for the thyroid, the Graves' disease, hyperthyroidism, it is again, like I said, an autoimmune disorder where your body mistakenly start attacking your thyroid gland, which gets out of control. It can be genetics, in the family line. It could be environmental, stress, or infection in your body that can trigger the Graves' disease. It's just, it could be a combination of things, of those causes that set your thyroid glands on. Okay, the thyroid eye disease. Say about 30% of the people that get Graves' disease get that, and sadly to say, I'm one of those people with the bulging eyes. And I didn't really realize that I had the bulging eyes. And I know my mom, she would sometimes ask me, "Why do you keep bucking your eyes at me?" And I'm like, "What are you talking about? I'm not bucking my eyes." But come to find out, due to the Graves' disease, I have thyroid eye disease as well. So I'm definitely working on that. I don't want to be walking around scaring folks, and they see me thinking something's wrong. Sometimes, you get that gritty sensation in your eyes, feeling that way. When I went to test with the thyroid eye doctor, they said I did have some pressure, behind my eyes, but they're not really sure if that's from the Graves' disease or if I'm getting glaucoma, which is also something bad. I don't want that, and I know that is her. My mom does have that. She's actually had surgery on that, so now I'm gonna have to go to a specialist on that. So you can get that puffiness, redness in your eyes. Some people you might get sensitivity to light, double vision or no vision. And I thank God I haven't, experienced the no vision part. That's not good at all. And some diagnosis and treatments. This is what your doctor, your health professionals will be discussing with you, or tests that they might do to figure out if this is what you actually have. What's going on when they're diagnosing you. For me, initially, in my family practice where I go, they did the blood test to test my thyroid levels. And when it came back, it was like extremely out of whack, So I was immediately, referred to a endocrinologist, a thyroid specialist, to make sure that is what they were describing was correct, and then to get on some treatments immediately for that. So that was one of the initial things that went on for me, is the blood testing to get it. But there are other types of tests that your doctor or healthcare professionals may want to do in your case. And some here are the antibody test, the imaging test. Um, and then some of the treatments for it, of course, is medicines, which I am on a anti-thyroid medicine. For me to get. For some people, they may choose to put them on a radioactive iodine uptake type of medicine. I'm not on that, and I was advised not to do that by one of the other specialists. So I'm working and try to do everything I can not to have to do the radioactive iodine treatments. And there are other treatments, the ultrasound, images. But again, it will be up to your doctor, your health professional, what they decide to choose for you. So this is totally new for me. So I'm trying to learn. And since it was initially on a health journey to get better health in the first place, now I'm going to have to tweak it up a little bit and see what types of foods that I need to eat, and for to help with the my thyroidism problem, my Graves' disease, to reverse it. The medicine that I'm on is a lot of times, if you once you're on it for a year and a half, It usually clears up the symptoms, and you don't have to have, you don't have to be on the medicine for life. You don't have to go into any other radiation treatments or any surgeries. So that's what I'm praying for right now, because I do not want to go through all of that. And so I want to change my diet, get healthy, to help this medicine along, to go with it. And by all means, this is a disclaimer. I am not a doctor. I'm not a dietitian. I'm not in the medical profession whatsoever. So please don't just take what I'm saying or what you're seeing on the screen as advice. Please consult your healthcare professionals. They each person is different. Each treatment is different for each person. Especially depends on how far along you are um, in your situation. Um, but anyway, if some of you have gone through this and overcome it, some of you may have recently been diagnosed and going through it right now. Please put some comments for me down there in the comments. Give me some tips. Let me know what happened with you. What happened that got you to start. On this get diagnosed or whatever. Leave me some comments, please. And also, please like, share, subscribe this video, and I will be coming back with other things, uh, to discuss on this as I'm learning, and I'm believing that I am healed, and I'm leaning on this scripture, Isaiah 53 and 5. But he was wounded for our transgressions, he was bruised for our iniquities. The chastisement for our peace was upon him, and by his stripes we are healed. So I am claiming my healing for this total healing, not partial healing, but total healing is what I'm claiming. And again, thanks everyone for watching. Thanks for watching the videos. Thanks for stopping by. Again, if you made it to me through this whole video, I thank you. Again, like, subscribe, and put me some comments down there. Thank you. Have a blessed day, everybody.